This is Dr. Pratista Strong of Kathmandu Clinic talking about the anti-inflammatory lifestyle. If you happen to find me on social media or some other location and you want to learn more about my practice and what I do, you're more than welcome to go to my website, drpstrong.com. And I have it right here. Let me get my drawing tool and make this a little bit more interactive. And what I do is I have a concierge practice in Kirkwood, Missouri. It's a suburb of St. Louis. I practice private personalized medicine. I speak with patients one-on-one. I don't take insurance because I want to free up that time to spend with that patient. And my practice is East meets West. I practice Western medicine in the prescriptive sense, but I try to lean more towards my Eastern roots. And so this anti-inflammatory lifestyle talk will have that as well. And I just want to make sure and let everybody know that I have no financial disclosures. Nope, I am not taking any of this any of the products that I mention as advertisement. I do promote some of them because they are just really good products, but that does not mean that I'm getting solicitations from advertisers to promote a specific thing. Medicine should be individualized to your specific needs. You are your own specialist. Please talk to your own doctor about your specific health condition, whether they are for you or not. It's up to you and your physician to decide. And if you want to see me, well, I do have a wait list, and you're more than welcome to go to my website and reach out. And I just wanted to kind of point out that all the talks are cited. All of their citations are always on the bottom. A lot of this talk comes from David Frankel's Integrative Medicine. It's not exactly the entire thing verbatim. There is a spinoff, and there are some other things that I've added for everyone's benefit. So inflammation, a lot of disease conditions have inflammation, whether it's arthritis, hypertension, asthma, COPD, all the way down to fatty liver, Alzheimer's or dementia, depression, PCOS. So all of these conditions and more have inflammation as a key component of that disease. So I know some people are told by their physician hypertension is just that, it's just your blood vessels getting stiffer and you need to be on medication, but there's so many things we can do with food that can change our health condition. And it's not just hypertension, it can be asthma, it can be COPD. And so this particular talk is geared to that, how food is medicine and how we can change our disease condition by just changing our food. So let's talk about food. Are you eating sad food? So if you happen to be from the United States, you are eating food that could be sad. And what does that mean? It just means that you're eating a standard American diet. Now, if you are from another part of the world, many of the great sad foods, the standard American diets, have been exported. No one knows any better. And so what is sad food? It is food that has high intake or heavy intake in processed carbs, a lot of processed meats, and we'll go through what that means, a whole bunch of added sugar, and very limited, very deficient in greens and green vegetables, fruits, and whole grains. So it's a recipe for disaster. It's a recipe for chronic disease, all those chronic medical conditions I just listed. So we can take that inflammation away, these particular inflammatory conditions, we can take them away. And we can just take some meds. We could stop inflammation by taking an NSAID, a non-steroid anti-inflammatory drug, right? We can take an ibuprofen, we can take naproxen, everyone knows these. We can take away our cardiovascular disease by taking a medication called a statin. Some examples are atorvastatin or rosuvastatin. We can, if we have some rheumatological conditions, we can take biologics in addition to all those things. And there's some big guns out there, Enbro or rituximab or things like that. Some DMARDs that you may be familiar with, depending on your disease condition, are like hydroxychloroquine, as an example. So we can stop all of our inflammation depending on our disease condition, and our physicians can give us a medication, and we can move about our day. But ultimately, they don't really get to the root of the problem. They don't get to the root. We're just looking at the trees and the leaves, and we're just modulating that. And they don't really get to that root cause. And that's why I like functional medicine. Functional medicine gets to root cause of disease. And we also get to the root element of how we can fix all these things. So when we take medications, it's just a Band-Aid. We're just covering it up, and we're not really fixing the problem. And so that's why I want to talk about food and how food is medicine and how food can actually modulate your disease condition. You can actually eat something and have your disease condition improve. So let's talk about inflammation, what it is first. We'll get to a little bit more of the technical stuff. And I'll give you examples of how food can actually influence inflammation. We can actually decrease inflammation or increase inflammation. So I'll give you some examples of that. So that way you can understand where this is coming from. So this is a kind of a complicated diagram. It's the arachidonic acid pathway, and this is how fatty acids are made and how other byproducts are made from those fatty acids. Omega-3s and omega-6s, those two are fatty acids. Those are essential fatty acids, and we'll talk about that in great detail down the bit. But let's just kind of talk about how they get processed in your body. So omega-3s, an example is linoleic acid. Linoleic acids, like for example in corn oil or something like that. If you eat corn oil, it goes into an enzyme. It gets an enzymatic reaction. And an enzymatic reaction is just moving, kind of like a factory shuttle, moving from one product to another. That's what an enzyme does. It changes that previous product to a second product, an end product. And these get changed by delta-6 desaturase into these other products, gamma-linoleic or dihomo-gamma linoleic acid. And delta-5s, then the delta-5s get triggered as far as in another enzyme, and that goes into making arachidonic acid. And COX-1 and COX-2 are enzymes, and that changes to thromboxane A2 and thromboxane B2. And then finally, we get to this end product of 11 dihydrothromboxane B2 as a pro-inflammatory. So we're going down this shuttle. Oh my goodness, we're going down this shuttle. And it turns out these are all a shuttle of pro-inflammatory products. And that's if we are just focused on omega-6s. So the same enzyme, I didn't have an exact amazing diagram for this, so that's why I put this together. If we were to take the same enzyme and we were to eat something a little bit different, like alpha-linoleic acid, which is found in, let's say, olive oil, and we were to take that and go down the factory shuttle, the same enzyme can switch the alpha-linoleic acid into EPA, or eicosapentaenoic acid, and then we end up with some great byproducts that are prostaglandin 1 and 3s and DHA, which is the docosahexaenoic acid, And these become anti-inflammatory. Lo and behold, wow, that's awesome. So just by a simple difference of oils, we can kind of change and modulate our pathways in our body. And a spice that everyone is relatively familiar with, it's very, very much prominent in our part of the world, in Nepal, where I'm from, is turmeric. Turmeric can actually modulate and reduce or actually suppress COX-1 and COX-2 enzymes. So turmeric, the benefit of turmeric is that it can actually stop this pathway, this inflammatory pathway, from happening, even if you're not maybe eating the best things in your diet. So turmeric is one way, a specific food, a spice group that can modulate our inflammatory reaction. So I want to kind of throw another chart at you. It's about the same kind of chart. It's just a little bit more complicated looking. A couple of things that they show is on the right here. This side is the arachidonic acid pathway, which we saw, and how they get made. And the arachidonic acid pathway, you can kind of see different things like aspirin and NSAIDs. And basically what we're doing when we're taking an aspirin or an NSAID, like ibuprofen or acetaminophen, is blocking this COX-2 inhibitor. And if anybody's ever been on a steroid, corticosteroid like methylprednisolone, or progesterone, we end up blocking the entire arachidonic acid pathway right off the bat. We don't even have this being presented to go down that pathway, so we block it off early. So these are examples of how different medications can be modulating our arachidonic acid pathway. And on this side, I wanted to kind of show TNF-alpha, specifically highlight TNF-alpha. It's a pro-inflammatory cytokine, and that gets modulated, right? So here's a mast cell. These are cells that release histamine, and other cells are like, I guess this is an astrocyte, which you don't need to worry about all these different types of cells. But the idea is that inflammation and inflammatory markers are complex. And TNF-alpha is a pro-inflammatory cytokine. IL-6 as well. And that one we can actually modulate just by a simple spice. Nutmeg, of all things. There have been studies that show that nutmeg is actually inhibits TNF-alpha. So 2 examples, you've got turmeric, you've got nutmeg. Another example, we'll kind of go through food and what specifically sugar, and what sugar does. So there's a blood marker called CRP, or C-reactive protein. It's a blood marker it's a protein that's in our body that gets released. And that protein can be of 2 things. There's CRP and there's high sensitivity CRP. And it's an easy blood test. Anyone can ask your physician to get it done, to look at, if you want to look at the markers of what your CRP levels are showing. High sensitivity CRP is usually really great to look at for cardiovascular health. CRP is a general, not as sensitive marker to look at overall inflammation. So these are inflammatory markers. And these inflammatory markers have been shown to be reduced just by eating berries. Yes, berries. Berries can actually decrease these CRP levels. And the studies, I think, have shown how they actually decrease in Italian subjects, in addition to joint inflammation. So very fascinating in that sense. So 3 examples of how food can modulate inflammation. Another example is, this is the example of sugar. I think I erroneously said that the last one was sugar, but this is the example of sugar. So when we eat sugar, when we eat just, a standard American diet of sugar, some kind of dessert, some cookie that has a lot of sugar in it, our glucose or sugar goes up in our bloodstream. It goes through our stomach and it gets processed and broken down, and all of that glucose goes into our bloodstream, and our pancreas says, oh, we have to make insulin. And when we make insulin in these high levels, high insulin and high glucose achieved by that standard American diet can actually elevate CRP. So these things, they have actually been studied and found. Plasma concentrations of CRP were found to be increased in middle-aged women when eating the standard American diet. So we know this. When we eat something bad, we feel bad. And the reason why we feel bad is because our body is actually getting modulated in such a way that it's a true thing. So this is a marker. Again, a marker. CRP is a marker of inflammation. And it can occur overtly before, rather, it can occur smoldering before an overt diagnosis of diabetes. So that is one great example of bad food leading to inflammation. Food actually can also change your genetic expression. So genetic expression relating to inflammation actually can get modulated with omega-3 fats. And we'll talk about what omega-3 fats are, but I have this tongue-in-cheek can of sardines that are kind of saying the same thing. This particular study found, the study is called omega-3 fatty acids, inflammation, and angiogenesis. So the study actually found a clear example of nutrigenomics. What is nutrigenomics? Nutrigenomics is how nutrients may affect gene expression and ultimately affect a wide spectrum of human disease. So you are what you eat. Multi-generational wealth. We're always talking about wealth and how we can pass wealth along to our progeny. This is multi-generational health in the sense that what we eat can modulate our own gene expressions, and that what we teach to our children and what we show them and what we feed them can change their health. Another example of inflammation and how certain foods can trigger inflammation or inflammatory disease is the gut. So gut dysbiosis, which is the gut microbiome, so all of this bacteria that is in our gut, whether it's in our, the majority of it is in our colon, small intestine, and then stomach. If not so much in our stomach, they all die in our stomach. The dysbiosis of our gut can be a trigger for inflammation. Gut microbiome, and I do gut microbiome testing all the time to look at people's gut health. This is a fascinating subject, and if your gut microbiome is not right, you can actually have disease. You can have inflammatory conditions. So all of these different examples are examples of inflammation in the body, and it's known to contribute to chronic disease such as heart disease or diabetes, asthma, inflammation in the gut, inflammatory IBS or inflammatory bowel disease, IBD rather, not IBS, arthritis, obesity, cancer, dementia. All of these things are modulated by our food and what we eat. So the anti-inflammatory lifestyle is not a diet. I want to express and stress that it's not a diet. A diet is very temporary. A diet is very fleeting. And the CDC actually puts this out there, that this is not a diet, it's a lifestyle. You should not be on a diet. You should have a lifestyle. And the anti-inflammatory lifestyle is definitely something that's good as you age, as you are in your 80s and 90s and even the hundreds. It's definitely something that you can age with. It's based on a Mediterranean diet archetype that's been studied widely. It's a pattern of eating, not a collection of recipes. It is a pattern of eating. So if you can follow this pattern, you can really master your health. Because food is medicine. It's a powerful tool. Food is medicine, and you can actually change your own health in this way. So there's a lot of diet trends out there, and I'm not necessarily poking fun at one or the other. The idea is that there are a lot of trends, and the trends, what a trend is it's temporary, it's fleeting, and it's not something that that you want to do for the rest of your life. There's keto and there's paleo, and Atkins used to be the repurposed. They went and repurposed it to keto. There used to be a raw food diet where everyone's doing everything raw, no one's cooking any of it. There's vegetarianism, which is a very long tradition, but it's sometimes the fad can come up and down. And there's veganism, and there's another one called pegan, where you take the paleo and the vegan and you kind of combine them together. And as of 2023, when I'm talking about this, there's even a 12 diet, which is, I think, a repurposed paleo, Atkins, keto type of situation. He means well, but again, these are temporary. The idea that the anti-inflammatory lifestyle is a lifestyle that you will take and change forever, if you can, is really the key. Okay? And I really like this term equalitarian. I'm equalitarian. We want to make sure and look at the food labels. We want to make sure we know what we're eating. And you want to read the ingredients. So the basic rule of thumb for shopping when you're going out and going to buy food is what is it? What is there? And I really like this quote from Food Rules from Michael Pollan. If your great-great-grandmother could not pronounce it or didn't know what it was, don't eat it. I think that's just so perfect and self-explanatory. And we'll talk about that qualitarian portion of things as we're going through the list of foods. Okay? So what this is a list. It's basically a list. It can even be a shopping list if you wanted to. It's a list from 1 to 10, and I've got a bonus 11, which is always fun. And I've got some super duper bonus round topics that we may expand into other lectures, so be on the lookout for that. And I'll kind of reference through all of these as a list.